to Chapter 8. Here we will talk about an overview of genetics and genomics in nursing. First, we will look at the Human Genome Project. Of course, international research effort focused on personalized medicine. This includes both genetic and genomic factors in disease causation, response to treatment, and health outcomes. When we look at the term genetics, this applies to single genes and their impact on relatively rare single gene disorders. The term genomics involves all of the genes in the human genome together, including their interactions with one another. When we look at nursing genetic and genomic competencies, nurses also must recognize that they are a vital link between the patient and healthcare services. Patients often turn to nurses first with questions about a family history of risk factors, information regarding genetics, and genetic testing and interpretations. Of course, to meet the challenges of personalized medicine, we as nurses must understand the new technologies and treatments of genetic and genomic based healthcare. Looking at genes and chromosomes, we want to know the genomic framework to nursing practice, and essential to a genetic and genomic framework in nursing is the awareness of one's attitudes, experience, and assumptions about genetics and genomic concepts and how these are manifested in one's own practice. To develop awareness of these attitudes, experiences, and assumptions, nurses must examine his or her own beliefs and values, philosophical, theological, cultural, and ethical perspective, level of expertise when we talk about genetics and genomics, experience with birth defects, chronic illnesses, and genetic conditions, attitudes about the right to access and other rights of individuals, views and assumptions about DNA and beliefs about the value of information, beliefs about reproduction options, and view of genetic testing and engineering, as well as approach to patients with disabilities. You also want to review what a genotype is and a phenotype, as well as DNA. Looking at a brief refresher on our chromosomes, note that there are 22 pairs of chromosomes called autosomes, and they are the same in females and males. The 23rd pair is referred to as the sex chromosomes. A female has 2X, whereas the male has 1X and Y. And here is a true or false statement regarding meiosis. And the answer with the rationale. When we look at inheritance patterns, and we look at Mendelian genetic pedigree, first we want to talk about assessment. Nursing assessment of the patient's health includes obtaining and recording family history information in the form of a pedigree. The first step is establishing the pattern of inheritance. Nurses must be familiar with the Mendelian patterns of inheritance and pedigree construction and analysis to help identify patients and families who may benefit from further genetic counseling. Mendelian conditions are genetic conditions that are inherited in fixed proportions amongst generations. They result from gene mutations that are present on one or both chromosomes of a pair. First, we will look at the autosomal dominant inheritance, and these conditions affect female and male family members equally and follow a vertical pattern of inheritance in families. A person who has an autosomal dominant inherited condition carries a gene mutation for that condition on one chromosome of a pair. Each of that person's offspring has a 50% chance of inheriting the gene mutation for the condition and a 50% chance of inheriting the normal version of the gene. Offspring who do not inherit the gene mutation do not develop the condition and do not have an increased chance for having children with the same condition. So, when we look at that in terms of diseases and disorders, let's talk about. I'm trying to think of a disease or disorder. Let's talk about the woman who has BRCA1 hereditary breast cancer gene mutation. So, if the mom has the breast cancer and she died from breast cancer, we want to then further genetically test the child because the child may have the same gene that the mother had. She has a 50% chance of having the gene or not having the gene. So she would truly be one that would need further genetic counseling. And when we look at assessing these patients, we want to try to get 3 generations of family history, especially if a blood relative has the disease or disorder or died from that particular disease or disorder. When we look at autosomal recessive, in contrast to the dominant conditions, the recessive conditions have a pattern that is more horizontal than vertical. Relatives of a single generation tend to have the condition. These conditions are frequently seen among particular ethnic groups and usually occur often in children of parents who are related by blood such as first cousins. In the autosomal recessive inheritance, each parent carries a gene mutation on one chromosome of the pair and a normal gene on the other chromosome. The parents are said to be carriers of the gene mutation. Unlike people with the autosomal dominant condition, carriers of a gene mutation for a recessive condition do not have symptoms of the genetic condition. The carriers have children together. There is a 25% chance that each child may inherit the gene mutation from both parents and have the condition. Cystic fibrosis is one of those conditions. So, if the parents come in, or if 2 parents come in and they ask you about having children, if the cousins had the disease, then this should set off a red flag because they're the first cousins, so they're those blood relatives, so they have a 25% chance of passing it along to the child. When we look at X-linked inheritance, X-linked conditions may be inherited in recessive or dominant patterns. In both, the gene mutation is located on the X chromosome. All males inherit an X chromosome from their mothers and a Y from their fathers. Because males only have one X, they do not have a counterpart for its genes as do females. As this means that a gene mutation on the X chromosome of a male is expressed even though it is present in only one copy. Females, on the other hand, inherit one X chromosome from each parent for a normal sex constitution. A female may be unaffected carrier of the gene mutation, or she may be affected if the condition results from a gene mutation causing an X-linked dominant condition. Either the X chromosome that she received from her mother or the X chromosome she received from her father may be passed on to each of her offspring, and this is a random occurrence. The most common pattern of X-linked inheritance is that in which a female is a carrier for the gene mutation on one of her X chromosomes. This is referred to as an X-linked recessive inheritance, in which female carriers have a 50% chance of passing it on to a son who would be effective, or to a daughter who would be a carrier like her mother. So some examples of this are your factor 8 and factor 9 hemophilia, severe combined immunodeficiency, and your DMD, or your Duchenne's muscular dystrophy. When looking at the multifactorial, non-traditional inheritance and complex genetic conditions, many birth defects and common health conditions result from interactions of multiple gene mutations and environmental influences. Some of those conditions include your neural tube defects such as spinal bifida and anencephaly. Looking at chromosomal differences and conditions, the differences in numbers or structure of chromosomes are a major cause of birth defects, mental retardation, and malignancies. Down syndrome, or trisomy 21, is a common chromosomal condition that occurs with greater frequency in parents of men that are greater than 35. Chromosomal differences may also involve a structural rearrangement within or between chromosomes. These are less common than the chromosomal conditions in which there are an extra or missing chromosome. Genetic testing and screening. Genetic testing is a primary tool used to identify individuals predisposed to specific genetic diseases. The tests provide information leading to diagnosis of inherited conditions or other conditions with a known genetic contribution. In genetic testing, approaches may be genotypic or phenotypic. Genetic testing can be used for various purposes in prenatal, pediatric, and adult populations. Your prenatal testing is widely used for prenatal screening and diagnosis of conditions such as your Down syndrome. Diagnostic testing is used to detect the presence or absence of a particular genetic alteration or allele to identify or confirm a diagnosis of a disease or condition, such as your myotonic dystrophy or your Fragile X syndrome. Nurses are increasingly involved in taking family histories and educating the patient about aspects of genetic testing. They contribute to ensuring informed health choices and consent, advocating for privacy and confidentiality with regard to genetic test results, and helping patients understand the complex issues that are involved. Now, when you're looking at genetic testing for certain diseases, you want to look at the cultures as well, because certain ethnicities and cultures, or people with certain backgrounds, are more prone to certain diseases, such as You may want to test your African Americans for sickle cell anemia before you would test your Caucasians for it, because it is prone to the African American population. So you want to look at that as well when you're talking about genetic testing and screening. It's not only getting that family history and doing a thorough background check on the patient, it's, screening for those diseases or disorders that are prone to that particular population. Looking at genetics and genomics in nursing practice, the five main tasks, of course: collect, interpret relevant family and medical histories. This comes along with your screening, of course. A thorough nursing assessment for adult onset conditions is based on that family history, personal and medical risk factors, and identification of associated diseases or clinical manifestations. One table that I do want you guys to look at is the applications for genetic screening that is found in your text on page 116, as well as the genetic test example of current uses, which is table 8-3, and that is also found in your text on page 116. And here is a true or false statement regarding genomics. And the answer with the rationale. Genetics family history. Of course, you want to assess the risk of certain diseases, decide on the testing strategies, whether it be genetic or other diagnostic tests. Establish that pattern of inheritance. That's when you want to get that thorough family history. Identify other family members that are at increased risk if it is someone other than the patient. Identify shared environmental factors, and of course, calculate those risks. When you're calculating those risks, you also want to explain these risk factors to the patient themselves and genetic predisposition, supporting informed health decisions and opportunities for prevention and early intervention, and protecting the patient's privacy. As nurses assess those family histories, like I mentioned before, which may include multiple generations, we at least want 3 if we can get 3. And you want to do a thorough workup. If an existence of a mutation for an adult onset condition in a family is identified, at-risk family members can be referred for predisposition testing. When we continue to look at genetic family history, we want to make sure that we assess the risk of passing on these conditions to children, especially if the patient is a woman of childbearing age. We want to look at those risk factors. We also want to do a thorough genetic assessment that addresses the ancestry of the patients and their families. Like I said, going back. Don't be afraid to go back 3-4 generations to see what is actually going on. Has the grandmother, great grandmother, and the mother had this problem? Has the father, uncle, and brother had this problem? So you want to look at those generational trends when you're doing that assessment. Also, inquire about the patient's ethnic backgrounds when assessing for susceptibilities to adult onset conditions like that cancer that we talked about before. If that patient may be susceptible to that, there are protocols for that. So the patient may need to get mammograms at the age of 30 versus the age of 40, depending on when the grandmother and the mother got diagnosed or, had the breast cancer. So those are things that you have to think about. As nurses, you want to also consider the patient's view about the significance of genetic conditions and how it affects the self concept, as well as the patient's perception of the role of genetics in the health and illness, reproduction, and disability. Assess, please assess the patient's beliefs, values, and expectations regarding genetic testing and also genetic and genomic information. This helps you, as the nurse, provide the most appropriate information about specific genetics and or genomic topics. I want you guys to look at chart 8-2 and 8-3 in your text on page 122 and 123. It goes over genetics, family history, an essential tool for all nurses. And it pretty much goes over a well-documented family history and how that can be used. Also, key questions to ask about each family member, and then indications for making a genetics referral, such as pre-pregnancy and prenatal, your pediatric population, as well as your adults. Following up with genetic counseling and evaluation services, people seek genetic counseling for various reasons and at different stages in life. Some are seeking preconception or prenatal information, others are referred after birth of a child with a birth defect or a suspected genetic condition, and still others are seeking information for themselves or their families because of the presence of or family history of a genetic condition. So, genetic services provide genetic information, education, and support to patients and their families. I want you guys to look at chart 8-6 in your text on page 125, which goes over the components of genetic counseling and genetic counseling across the lifespan, which is chart 8-7. Of course, you want to respect the patient's right to self-determination, that is, supporting decisions that reflect the patient's personal values, beliefs, and interests, and that is a central principle in directing how the nurse provides genetic and genomic information and counseling. Nurses and others participating in genetic counseling make every attempt to respect the patient's ability to make autonomous decisions. And of course, last but not least, you want to provide confidentiality and, most importantly, support. You, as the nurse, you must honor the patient's wishes while explaining to the patient the potential benefit of the information. Last but not least, we'll finish up with talking about genetics and genomics, and then we'll close out by looking at a couple of ethical issues. Of course, lifestyle changes and risk for chronic disease. You can refer to chart 8-4. That is found in your text on page 126. The psychosocial factors that impact genetic health, that is located in chart 8-5, and that is also found in your text on page 124. And then, like we talked about, those components of genetic counseling and counseling across the lifespan, because you may not have a 30-year-old patient every time coming in to talk to you about preconception or prenatal genetic testing. It may be a much younger person, an adolescent, that is seeking counseling because their mother died from breast cancer, or a male that has Turner syndrome or something of that nature. So you have to know or understand how to counsel across that lifespan. And finishing up, we'll talk a little bit about some ethical issues that you may run into. Of course, we'll talk about it in the faith about confidentiality and privacy and respecting the patient's rights and their wishes to autonomy and self-determination. You cannot do anything against the patient's will. And a lot of people in this field can feel like they're discriminated against depending on what they're seeking counseling for. So you want to make sure you're providing support and the most accurate information that you can. Another big issue that you may come into contact with is insurance. If your patient has an immune disorder or something of that nature and they're afraid that they're going to lose their insurance, please tell them that HIPAA prohibits the use of genetic information to establish insurance eligibility. But do warn the patient that although they will not lose their insurance because of their genetic factors or their disability or disorder, insurance companies do have the right to charge them higher premiums for these diseases and disorders, and we see this every day being done. So although HIPAA prohibits them from excluding them from getting insurance, it does not prohibit them from charging them extra for having this disease or disorder. Now, is that wrong? To me, yes, it is. But state legislation has not done anything to prohibit that as of yet. And that's been years and decades, so not sure that they're going to change that anytime soon. So to finish up, it is very imperative that you all as future healthcare professionals become fluent in the language of genetics and genomics so that you can provide the most effective nursing care when it comes to this issue. And that will conclude Chapter 8, which was the overview of genetics and genomics in nursing.